My name is Jessica Parker. Thanks for joining me. As a speech-language pathologist, my job is to help people with aphasia improve their ability to communicate and to maintain social connections and independence. A big part of that process is educating and training caregivers like you about your important role in the rehabilitation process. That's why I'm so glad you've decided to take a moment to learn about how you can support individuals with aphasia as they continue on their rehabilitation journey. You're already off to a good start because it's important to educate yourself about aphasia. There are lots of ways to learn. You can ask to attend speech therapy sessions with your loved one, or attend an aphasia support group near you. Our caregiver coaching videos are also designed to provide the education that caregivers need. There are also many organizations dedicated to improving the lives of people with aphasia and their caregivers. Here's a list of just a few of these organizations, which includes the National Aphasia Association and the American Stroke Association. Another role of the caregiver is to be an advocate for people with aphasia. Once you've learned about aphasia, you can then educate other family members, friends, medical professionals, and really anyone else in the community about how they too can support communication when interacting with people with aphasia. As a caregiver of a person with aphasia, it's also important for you to practice being patient. You can start by budgeting more time for conversations. Often the stress placed on a person with aphasia when they feel rushed to get their message out just makes communicating clearly that much harder. When the communicator has trouble expressing themselves, give them more time to respond and prompt them to use the communication strategies and tools they've learned in speech therapy. It's natural for people with aphasia to avoid social situations when communicating is difficult. As a caregiver, you can encourage the person with aphasia to stay connected with their family, friends, and hobbies. Practicing communication is an important part of aphasia rehabilitation, and it's especially helpful when that practice happens in meaningful and motivating settings. It's very common for people with aphasia to become depressed, especially when aphasia is caused by stroke. It is important to be aware of symptoms of depression, such as sadness, irritability, agitation, and appetite loss. If you suspect that a person with aphasia is depressed, help to communicate that information to their doctor and seek treatment from mental health professionals who have experience treating people with aphasia. The Caregiver Coaching Series is designed to provide caregivers with information about aphasia, delivered in a way that is easy to understand. You will also receive many helpful tips that you can start using right away. As a caregiver of a person with aphasia, you can play a very important role in their recovery. To learn more about how caregivers can support individuals with aphasia, check out the other videos in our Caregiver Coaching Aphasia series by going to www.adultspeechtherapyservices.com.